Good afternoon. First of all, I'd like to thank the Board of Directors at Brookdale Senior Living Incorporated for inviting us here at CARE, the Consultant Association for Response Ethics, here today. As a leading operator of senior living facilities within the United States, the care and well-being of seniors must be evaluated above all. However, this has not been the case for Brookdale. In a South Carolina Brookdale facility in 2017, a 90-year-old woman with dementia was to be monitored at all times till she was later moved to a special facility. Yet on the night of July 27th, no one noticed Bonnie Walker slip outside of the building, which then immediately locked. No one noticed whenever the security bell went off at 12:15. And after 7 hours of being locked outside, did someone notice her body half eaten by alligators in a nearby pond? This is not the only case of Brookdale's negligence, and with hundreds of lawsuits piling up against the company, potential inhabitants and investors are running away in fear. And as the board knows, this has left Brookdale struggling financially and residents in horrific situations. Bonnie Walker's case is not unique, and it is sure not to be the last unless we do something about it. So first, our ethical consultant, Julia Linkogel, will uncover the systematic negligence and malpractice in these facilities nationwide. Next, our legal consultant, John Costomo, will examine how those ethical dilemmas have fed into numerous lawsuits. Our financial consultant, Jonathan Gurrier, will examine how those ethical dilemmas and lawsuits have fed into hurting Brookdale's bottom line. And finally, IT Jen Jones, lead consultant, will examine what can be done in order to not only help Brookdale's future bottom line, but on how we can solve these ethical dilemmas with a substantially higher and stable revenue moving forward through a multi-tiered accountability solution that we call AIM. And now to Julia.
Thank you, Tijen. So for Brookdale, thank you, Tijen. So as the example you pointed out, I think really exemplifies that Brookdale has a history of ethical issues, specifically issues falling under the umbrella of negligence. So much so that the amount of lawsuits building up to these issues led to a 2018 change of CEOs. Led by your new CEO, Lucinda Imbeyer, the company is now focused highly on quality and a win local focus that has three aspects. The first of which is obviously providing high quality associates to in turn provide high quality and personalized care for Brookdale's residents, which in turn will yield a more financial stability for performance for Brookdale stockholders. So while this focus did help a little bit with Brookdale's financial stability with the cutting of expenses, and the win local approach did in fact improve a bit of community within Brookdale's facilities, there are still serious ethical issues existing within Brookdale's operations, specifically falling under the umbrella of negligence. And it is imperative that they be solved because these are the same issues that were present before the 2018 change. Now, negligence in the medical industry is a serious ethical issue and refers to medical malpractice, or the failure of Brookdale and its associates to provide ordinary, proper, and diligent care to its residents. Some easy examples of this would be the failure of certified nurse assistants to check on patients in a timely manner, as was the case with Bonnie Walker. There are also instances of patients being inappropriately placed within facilities, as in an instance just 7 weeks ago in a Brookdale Sandia Springs facility. In Rio Ranchero, a man named Gilbert Ware was beaten to death by his roommate who suffered from dementia. Now, I'm sure that a board member as well as any practitioner could tell you that this should not happen. A man with a known cognitive impairment as dementia should not have been placed in an environment where they could cause himself or others harm. Because this actually did occur, we can see that many employees, as maybe using the system itself, his symptoms were ignored, and his family has filed another lawsuit against Brookdale for wrongful death and negligence. There's also other instances. As we can see, there's a current class action lawsuit with 6 additional plaintiffs, all with claims of negligence against Brookdale's facilities in California. There have also been instances of sexual abuse, as was the case in December of 2019. a Brookdale employee was arrested and charged with second-degree forcible rape of one of his patients. This is a serious issue, and not only does it go against Brookdale policies and ethical code, it goes against the National Code of Ethics, a National Medical Code of Ethics, which are standards that Brookdale and its employees should be held to. The first of which states that a physician shall be dedicated to providing competent medical care with respect and compassion for human dignity and rights, such as the right to a safe and decent living environment free from neglect and abuse, or the right to adequate and consistent health care. The eighth principle also states that a physician shall, while caring for a patient, regard responsibility to that patient as paramount. These principles are being ignored when you have cases of patients being left to their own devices or being denied access to medical care, as was the case with the 2018 series of cases where when Medicare aid for a specific set of patients was being cut off because they were running out of funds. Now, this was, of course, without the proper checks and medical requirements for a patient to be discharged from a facility, and therefore these patients were being cut off from medical care abruptly and without warning. This is a serious infringement not only of company policy, but of these patients' rights. From a practical ethical standpoint, a lot of people know someone or will one day end up in an assisted living facility. People should not have to ask the question when they see these people in these facilities, will my loved one be neglected or abused? It's not something anybody wants happening to themselves or the people that they love and care about. And it's not a question that we want our potential residents asking themselves or having to ask their family and friends. We want Brookdale to become a trusted source for this community. And therefore it is imperative that we make these changes to become more ethical. But the question is who is accountable for these actions? We are aware that Brookdale is a medical company and responsible for its employees, but these instances have continued past the 2018 change, which states that there's something wrong with the way Brookdale is currently hiring and training employees. Currently, employees only get 4 to 6 hours of video online training, which is losing an opportunity for these employees to have facility-specific training experiences, and for Brookdale to conduct an emotional integrity or an ethical integrity check. There are also other additional solutions we can implement, but for now, let's look at the legal impacts of these ethical issues with John, our legal consultant.
Thank you, Julia, for covering these essential ethical aspects. Now, I'll be taking these essential ethical aspects and taking them further into examining Brookdale's troubled legal history. Now, I don't have to remind the board that Brookdale is the largest senior living facility provider in America, with 1,100 facilities in 45 states, housing more than 100,000 patients and 70,000 employees. And for a company as large as Brookdale, change is difficult and time-consuming. And we've seen that with the attempted and unfortunately failed reform in 2018, where, despite good intentions, serious problems still remain. And the core issue is that Brookdale has a legal obligation to its patients and clients, many of whom cannot speak out for themselves, and these obligations simply haven't been met. To better understand the situation, we need to examine two different moral agents and two different issues Brookdale has struggled with. Individual Brookdale staff members abusing patients in their care, and Brookdale as a whole and its issues with systemic negligence. Starting with the former, abuse violates the trust between caregivers and their patients that is the cornerstone of assisted living. It severely damages Brookdale's public image and alienates clients from choosing Brookdale going forward. Going back to what my colleague Julia mentioned earlier, nowhere is this clearer than the case on December 19th, 2019, when police arrived at a North Carolina Brookdale facility at 3 a.m., responding to a reported sexual assault. Joseph K., age 47, an employee at Brookdale Senior Living, was arrested and charged with second-degree forcible rape of a 79-year-old resident who had been placed in his care. Now, in response, Brookdale released a statement stating that all hiring policies were followed in regard to this individual. But this merely shows that Brookdale needs to go beyond merely satisfying state regulations and ensure a higher standard of quality in Brookdale employees through higher barriers to entry and improved training programs to ensure that instances like this don't happen again. Now, let's move on to negligence and examine the case of Joanne Boyce, who died 3 months after moving into a Brookdale facility due to severe bed sores, consistent with not having left her bed in weeks. Her death led to a $23 million settlement plus $4.3 million in court fees for the wrongful death of a single patient that was entirely avoidable. This negligence is systemic throughout Brookdale, and it needs to be addressed as such, on a company-wide level, from the top on down through all layers of management. Because as it stands, lawsuits are a part of regular business for Brookdale. There is even a law firm, the Senior Justice Law Group, that specializes exclusively in lawsuits against Brookdale. Earlier this year in Florida, a class action lawsuit was filed and settled, alleging that Brookdale failed to properly account for residents' assessed needs in determining staffing levels. Brookdale settled this case out of court, and as part of that settlement, they agreed to remove language stating that they adjust staffing levels to meet residents' changing needs. But this is simply kicking the can down the road and opening up Brookdale to further lawsuits. Because while they cannot be rightfully attacked for lying about adjusting staff levels, there is still the underlying issue of residents not getting the level of support they need, and staff members being overworked that leads to the neglectful and abusive environments that simply cause further and more expensive lawsuits. And on the subject of larger and more costly lawsuits, as well as Brookdale not meeting the needs of its residents, we need to discuss that ongoing class action lawsuit in California my colleague mentioned, where 7 patients from 7 facilities in California are suing Brookdale, alleging that they violated the Americans with Disabilities Act. The complaint alleges in part that understaffing means that disabled residents' daily activities cannot be met, and U.S. District Judge Haywood S. Gilliam Jr. said that the claim was sufficiently alleged. This case was filed in July of 2017, and a court date has yet to be set, with the motion to certify the law's class action expected to be filed by the end of this month. If it is certified as class action, and by all accounts it will encompass the 5,000 Brookdale residents in California, and with claims of up to $9,000 a resident, potential damages are over $45 million. But that's just the start of this. This lawsuit only covers Brookdale, California facilities, a mere 5% of their total patients. But the precedent is far more dangerous. At $9,000 a person and more than 100,000 patients nationwide, a similar lawsuit at the federal level based on this precedent could see over $900 million in damages, with court fees likely in the millions as well. Now, this lawsuit has been going on for 2 years and is still only approaching trial. Brookdale needs to get out ahead of this by undertaking substantial reforms to reduce neglect at Brookdale facilities. Because without it, Brookdale is leaving itself open to needless and costly lawsuits. Billion-dollar lawsuits are how industry leaders like Brookdale's go bankrupt. And that doesn't need to happen. By focusing on accountability, employees, and the legal obligations Brookdale has towards its residents, Brookdale can help resolve its troubled history with lawsuits and show the world that it has changed for the better. And with that in mind, I'll hand it off to my colleague Jonathan to examine Brookdale's financial situation in more detail.
Thank you, John, for your thorough legal analysis. When we analyzed Brookdale, its competitors, and the relevant research literature, we saw that Brookdale's had many financial struggles related to its ethical issues. But we also saw that there are lots of opportunities for growth with little to no identifiable downsides. And we found this using 3 points of analysis: stocks and market capitalization, financial statements and how it relates to current lawsuits, and the outcome of ethical business in the market. So the first point of analysis we used was stocks and market capitalization. So stocks generally represent how a company is viewed in the public, and there are many aspects that I'll go a bit into in a moment. And the market capitalization simply represents the total value of a company on the stock market. So for this analysis, we decided to compare Brookdale to three much smaller competitors: Welltower, Ventas, and Omega Healthcare Investors. So when we look at Welltower, we see that their stock sits at a little over $56, and they had a market cap of a little over $20 billion as of April 2020. When we look at Ventas, we see that their stock sat at a little over $33, and they had a market capitalization of a little over $11 billion as of April 2020. And finally, when we look at Omega Healthcare Investors, we see that their stock sat at a little over $34, and they had a market capitalization of a little over $7 billion. When we compare these three companies to Brookdale, Brookdale has a measly stock of a little over $3, and they had a market capitalization of a little over $660 million. So why do these three companies, the differences between these three companies and Brookdale matter? These differences matter in that stocks don't simply represent how big a company is, but they also represent how a company is viewed financially, as well as its business practices. And a major factor in that is its ethical practices. And we compare Brookdale to other industry leaders like Apple, Amazon, and Netflix. You see that Brookdale sits out like a sore thumb in that these companies have higher stocks and market capitalizations than their competitors, but Brookdale has lower stocks and market capitalization than much of their competitors, so indicating that Brookdale is financially and ethically untenable to potential investors. So the second point of analysis we decided to use was financial statements and how it relates to current lawsuits. So for this analysis, we decided to compare Brookdale to a similarly sized competitor, 5 Star Senior Living. So look at Brookdale's finances. You can see that over the past 4 years, their revenue has actually decreased. And though their net income from 2018 to 2019 actually did increase, this was primarily due to the cutting of expenses, particularly in the area of the acquisition of new businesses, indicating a waning confidence in their businesses going forward. We'll compare this to 5 Star Senior Living, on the other hand. We see that 5 Star Senior Living's revenue has actually increased over the past 4 years, and they've also seen a modest increase in their net income. So why the differences between these two companies matter? These differences matter in that the only identifiable difference we could see between Brookdale and 5 Star Senior Living is the presence of major ethics violations and lawsuits on the part of Brookdale. So now this relates to lawsuits in that the efforts by Brookdale to mask their financial underperformance by cutting expenses will be gutted through their negligence to address these ethical issues by causing increases in their expenses due to lawsuits they'll have to pay out. They already were paid out in the past in the millions of dollars and will likely increase, as my colleague John noted. Now, this is not just noted by us. This is noted by Brookdale itself in its latest financial report. So the final point of analysis we decided to use was, how do ethical businesses fare in the market? And we looked at the relevant research literature. We found that the research literature is clear. Ethical businesses simply do better. As noted in an article in the Journal of Business Ethics, we found that companies like Southwest and Ritz-Carlton have benefited from and become industry leaders because of their ethical business practices towards their employees and their customers. Furthermore, research going as far back as 2003 has found that companies that instituted ethical training for their employees financially outperformed companies that did not. And we can see that research in a report done in 2013 and published in the Harvard Business Review found that ethical business practices are among the most important factors in business success. Tangibly, we also see that this is true. As a report done in 2016 by the research firm Just Capital found that their ethical leaders' stocks, the leaders on their ethical charts, their stocks financially outperform their competitors by 1 to 4 percentage points. Even more, we can see that consumers are willing to buy from ethical companies. In fact, in the global poll of 30,000 people done by the market research firm Nielsen, found that a slight majority of them said they had bought from an ethical company within the past year. Furthermore, another study done by the market intelligence firm Mintel found that 56% of consumers said they would stop buying from a company they saw as unethical. And even more, a little over 30% of them said they would stop buying from that company even if they had no substitute for what the company provided. And this is relevant to Brookdale in that when we look at what the people who are looking for senior living arrangements want out of a senior living arrangement. We found that a study done by the AARP's Public Policy Institute on the opinions of caregivers, largely family members of seniors, as well as potential customers of Brookdale, found that the #1 factor for them in considering a senior living arrangement was safety. This is important, as this is crucial to the ethical issues that we are here to address. And with that, I'd like to pass it off to Tijen with solution.
Thank you, Jonathan. In order to definitively halt the progression of malpractice and negligence, which has spurred both significant legal and financial difficulties for the company, we have formulated a multi-tiered accountability solution that we call AIM. AIM looks at the 3 major categories in which effective solutions need to occur: administration, inhabitants, and marketing. The first phase of our plan addresses the major elephant in the room: administration. In order for a company to be effective, those that overlook the day-to-day operations have to be looking in the first place. This means that we must first overhaul management in facilities with pending lawsuits. This would root out the problems in those facilities while saving Brookdale millions in legal fees currently and in the future. Next, regarding the lawsuits that my colleague mentioned, detailing understaffing in Brookdale facilities, a new standard of consistently assessing residents' needs and either assigning sufficient staffing or relocating that resident to another Brookdale facility that can actually meet their needs is essential. The current policy invites bigger and costly lawsuits and sets the standard of Brookdale paying thousands of dollars per resident that come forward. And by fixing this, we ensure that Brookdale is consistently not only helping their future bottom line, but allowing residents to live in a safer and better environment that meets their needs. There's also a systematic problem of Brookdale facilities with a lack of training for new personnel. In order to resolve this, rather than the current system of watching videos for 4 to 6 hours as the only training, AIM adds on to that initial company training by assigning a buddy to work closely with new personnel for a week after that initial video orientation, with a daily check-in by a manager over that period. This is 7 times more facility unique experience than they are currently going in with, and allows for actual hands-on training, as well as a check of character that has never previously been had. These short-term solutions actually address the major problems and accountability for Brookdale. The next phase focuses on the inhabitants of the facilities. While we are confident in the steps that our plan provides for administration, extra accountability measures are essential for senior care. This is why AIM gives residents a way to speak up. While residents and family are currently able to call into the management of their facility if they feel as though they've been mistreated, this is not enough. And as lawsuits have indicated, if management is a part of the problem facing the resident, then they likely have no vested interest in a solution. This is why AIM gives a copy of the Brookdale Integrity Line to each resident. This Integrity Line is a current confidential phone service that receives reports of questionable actions or practices and feeds directly into the corporate offices. This line is currently only available within the employee handbook. However, once again, if staff is feeding into the problem, then the likelihood of something being reported is minuscule. By having this line in place, problems are able to be solved before anything major is allowed to occur. There's also a systematic problem of a lack of security for inhabitants. Currently, there is no way to check if staff on duty is awake and attentive 24/7 as Brookdale has promoted. And with numerous accounts of seniors being locked outside of the facility and then dying at night, a nightly check-in system needs to be put in place. This check-in system would have employees clock in, just as they were checking in, with each hour online through their unique employee PIN number from 8 p.m. to 8 a.m. This effectively checks if staff is awake and attentive to anything occurring in or outside of Brookdale facilities. This saves millions in legal fees and hundreds of lives. The final phase and the most important looks at marketing. Brookdale has not done enough in order to market ethical soundness, and as stock prices show, the public has noticed. With public lawsuits consistently being brought against Brookdale nonstop and class action ones currently in progression, people are turning away from Brookdale. While the first 2 phases focused on internal solutions, The final one integrates those phases within the brand's name, and this will be done in 3 ways. First, a code of ethics and a commitment to quality must be integrated into Brookdale's website. Each of Brookdale's competitors have one, and it shows everyone where the company's priorities lie. Next, we need to take responsibility for the current lawsuits. While this is a costly solution, it ensures that no other names are added onto that major class action lawsuit. A 3-year and counting lawsuit will finally be resolved. And most importantly, it shows to everyone that Brookdale will take action and it will be resolved. And with the current upheaval of that management, we can see that the risk of another future lawsuit is greatly minimized. And next, media interaction is essential. Brookdale needs to place the initiatives of AIM onto Brookdale's personal news site and any other media outlets that have mentioned the current class action lawsuits. By doing this, it shows to everyone where Brookdale's priorities lie, as well as showing that Brookdale is taking actual action. These long-term solutions focus on Brookdale and how it will continuously succeed. By initiating AIM, we'll be proactive rather than reactive. And given the current situation, it is plain to see that negligence in facilities is only amplified by a massive pandemic targeting at-risk people groups like those that you care for. However, by implementing these solutions, it will be clear to all that Brookdale is aiming for a better future. Thank you.